Hello, good afternoon. Welcome, I'm Vincent Obita, and today I'm going to take you through midstream urine sample collection and also the urinalysis. So this is a GP setting skill, and again it's also a 12-minute station. So for this case, I enter the scene, check for scene safety, my scene is safe to approach. I do hand hygiene using the 7 steps of hand hygiene by WHO. Okay, good afternoon.
Good afternoon.
Yes, I'm Vincent Obita. I'm the nurse going to take care of you today. Okay, can I confirm a few details with you?
Okay.
Yes, kindly your full names.
Sally Bloom.
Sally Bloom, and your first line of address?
2 Long Street.
2 Long Street, and your date of birth?
04/4/1940.
Okay, 04/04/1940. Thank you. So I have the right patient. Now, Sally Bloom, do you have any allergies to any medications?
No.
Okay, any allergies to food, plaster, or latex?
No.
Okay, and are you in any kind of pain right now?
No.
Okay, I'm happy to hear that you are comfortable. Now, Sally, I'm here to show you how to take a midstream sample urine. This is as per request of the GP to check your urine for any abnormality and at the same time to determine any symptom of urinary tract infection. Is that okay with you?
Okay.
Okay, thank you so much. So I'll prepare my equipment, then I'll come and show you and we proceed. Is that okay?
Alright.
In case you need me, just call my name and I'll be back, okay? I'll do hand hygiene. Proceed to my preparation area. And in the preparation area, I'll do a full hand wash. And for the full hand wash, I'll open the tap, wet my hands, put sufficient amount of soap, do palm to palm, palm over dorsum, fingers interlaced, fingers interlocked, tip rotation, thumb rotation, wrist rotation. I rinse my hand using a paper towel. I dry them from top to bottom, again top to bottom. Close the tap using my elbow. I'll then put on my apron. Now, assessor, as my trolley and tray been cleaned and ready for use?
Yes.
Okay, thank you. So for this procedure, I'll require the reagent strip for the urinalysis. It is intact, expiry date 2022. I confirm if I have sufficient number of strips. They are enough. Happy to use. I also have a dry tissue. Happy to use. I'll require an empty bottle to give to my patient with the patient details, and it's ready for use. I'll require a stopwatch to monitor the reaction of, to monitor my urinalysis strip. I'll also require my documentation chart and pen. I'll also require 1 pair of glove and a hand gel. It is clear, expiry date 2023. I'm happy to use. I do hand hygiene and proceed back to my patient. So, Sally, I'm back. How are you doing? Are you happy we proceed?
Yeah.
Okay, thank you so much. So first, I'll show you how to take the midstream sample urine, okay? Are you able to go to the washroom right now?
Yes.
Okay, thank you so much. Now, I'll require you to go and wash your private area, but before that, kindly do a hand hygiene, okay? With soap and water. Then I would request you to wash your private area using either soap water or the wipes. Which one would you prefer?
Wipes.
Okay, thank you so much. So for the wipes, you will clean your hands. Then using one wipe, clean the farthest portion of your private area from front to back in a single stroke and discard. Pick another tissue, clean the nearest portion of your private part and discard it in a single stroke. The third wipe, or clean the middle portion and discard it immediately. After that, clean your hands. After cleaning your hands, you will have this sample bottle. I would require you to open it. Start a stream of urine, and after passing 10 to 20 minutes of urine, introduce this sample bottle. After opening it, collect 10 to 20 mils of urine and don't fill it, so that don't fill it because it will overflow and contaminate the other portions. After that, remove it and pass the remaining portion of urine to the toilet. Close it, clean your hands, and then bring back the sample bottle with the urine to me. Is that okay?
Okay.
Are you able to do that one?
Yes.
Okay, kindly have this. Okay, thank you. I'll do the hand hygiene. And prepare my strip as I wait for the patient sample. I'll open my tissue and remove the strip without touching the inner portion and place it on the tissue. Put on, I do hand hygiene. Then I will put on the gloves. Okay, now I have my sample from the patient and with the watch ready. And now be ready to dip my strip into the sample. Assessor, I'm going to dip the strip for less than 1 second. I open the sample without touching the inner portion, and I'm going to dip it for less than 1 second. Okay, and now I have the sample and I've already started to count my 30 seconds. I remove the gloves immediately, do hand hygiene as I wait for the 30 seconds to read my glucose. Okay, and I have my paper here. And the 30 seconds are over and my glucose is the stresses. I wait for further 10 seconds to read the ketones. The 30 seconds are over. I wait for 5 seconds for the specific gravity. Okay, I have the specific gravity. Okay. I wait for further 15 seconds to read the blood, and the blood there is 60 seconds. I also read my protein. I read pH and the nitrates as well. And it is within 1 to 2 minutes. I'll wait to read my leukocytes. Okay, and it is exactly 2 minutes. I read my leukocytes. Okay, now I'm done. Assessor, would you like me to leave the strip or I discard it?
Yes, sir.
Okay, thank you so much. Okay, then now with the results, I go back to the patient. Sorry, Assessor, before that, I'll rip off the apron and do hand hygiene. Then I go to the patient. How are you, Sally?
I'm good.
Okay, thank you so much. I'm now back. Okay, with the preliminary result for the sample you provided. Now, various aspects of the sample are within the expected range, okay? But I'm slightly concerned about the presence of glucose. Are you diabetic?
Yes.
Okay. For how long have you been diabetic?
All my life, mostly.
Okay. And do you take your medications as prescribed?
Sometimes.
Okay. Do you have any challenges with taking your medications?
No, not really, no.
Okay. Okay, I would advise you adhere to the schedule that is provided so that your blood sugar can remain controlled, because the traces of glucose is showing that your the sugar levels are relatively high. Is that okay?
Okay.
Okay, thank you so much. So actually that's the only aspect that is off the range, okay? But again, don't be worried. This sample will be taken to the laboratory for further analysis, okay? And the results will be out in 2 to 3 days, okay?
Okay.
But if you have any concerns in between, you can reach out to your GP directly. Is that okay?
Alright.
Do you have any other questions?
No.
Okay, thank you so much, and thank you for your cooperation. As I said, you will be informed of the outcome, okay?
Alright.
Okay, thank you so much, Sally, and bye. So assess the sample and send to the laboratory for further analysis, and provide the patient and let the patient be provided with the result in 2 to 3 days. Okay, thank you so much.